Hello, I'm Dr. Peter Chitty from North Shore Veterinary Hospital and Veterinary Specialist Centre. Welcome to our hospital. We're based in Artarmon and we've been in existence since 1935, serving the community of the Lower North Shore. We run a general practice and a specialty practice. For those who don't know, that means that we have veterinarians who've trained in certain things such as surgery, medicine, and we've recently in the last 12 months moved to our new premises, purpose-built vet hospital in Artarmon, where we've been able to provide even better service to the community. North Shore Vet Specialist Centre also runs a 24-hour emergency clinic. So that means we're open every day of the year, 24/7. It means we have manned with a wonderful team of veterinarians and vet nurses looking after your pets. We also run a pet ambulance service as well, so that enables us to take clients or animals from referring vet hospitals in the area, and they can come here for more advanced care when their local vet shuts. North Shore Vet Specialist Centre is what we consider a state-of-the-art facility. So when we were building this facility in the last 12-18 months, we went to some of the leading places to have a look at the equipment that they've got, such as the Chris O'Brien Lifehouse near RPA. And we sort of took the best of that equipment, from sterilisation to equipment to lighting. So when you come around our vet hospital, which we're delighted to show people around, you will see basically medical grade equipment throughout the hospital. A lot of it is ex-hospital equipment, which is no longer fit for purpose and gets redeployed. So things such as our 128 slice CT machine has been used in hospital situations. Our equipment that we use for retrieving funny things out of dogs, such as needles and fishing hook, it's a human grade endoscopy equipment, so we're passing those cameras down. So really there's not a lot of difference between the equipment that you'll see through here and the equipment that you'll see through hospitals. So our vet hospital runs a gamut, what we call a multidiscipline hospital. So you can start by boarding your animal here, your dogs or cats, so we've got purpose-built catteries right the way through to top end, as I said, surgeries, doing very finite surgeries from eyes to abdomens. We also run, which is kind of unique to us, an exotic department. The exotic department, they aren't just exotic people, but they run from looking after guinea pigs, ferrets, rabbits. Some people don't like to hear me say this, but they also look after snakes and reptiles. And we also have a veterinarian on deck now who actually looks after birds as well. So an avian department. So obviously animals don't know what they're doing when they're coming in here, as much as we try to calm them down. So some of the things that we're going to do is obviously they're not going to be used to, like putting them through a CT machine. So often that starts with discussions with the veterinarian. If we know we're going to be doing a CT, often we might start the animals pretty early on some sort of calming or relaxing medication. To have the procedures such as CTs and MRs, those procedures we need to anaesthetise the patients for. So that starts with pre-medications just to quieten them down, and anaesthetics, so they're not scared or aware of what's going on around them, and we can do the procedures safely and quietly so that they're not getting stressed out. Because obviously for the animals, we know we're trying to help them, and you probably know they're trying to help them, but they don't know what's going on. So often anaesthesia is what we use. Dentistry would be another area where we're often telling our clients we're just doing the same thing that you're having done with a dentist, so a scale and polish. So there's lots of things that, emergencies may occur. If you're in any doubt, obviously ring us, but things that you should be on the lookout for, uncontrolled vomiting, diarrhea. If your animal has sudden signs of lethargy, so being quieter than normal, increase and change in respiratory rates, so if they start to seem to be blowing up or breathing a lot more, and obviously if there's any cuts. So if you're seeing blood, obviously there might be something that we need to see and help. The other things that you should be always in tune with is what is your pet doing, and often the basic things, eating, drinking, urinating, defecating. If there's any change of those, often that can indicate something that we need to. An example would be cats having urinary tract problem, which is a common occurrence for us, particularly the male cats. And it's, often your vet will be telling you to get them on appropriate foods, but if your animal hasn't urinated and you're aware it hasn't urinated within a 12 to 8 hour period, or even shorter, it's something that alarm bells should be ringing, and you should be going down to see your local veterinarian, because it's one of the things that cats can get blockages. Dogs as well, probably one of the more common things that they can get is a condition called bloat. whereby their stomach expands and twists on itself. And that's another really what we consider a veterinary emergency. We need to see you as soon as we can. So it's a matter of ringing us up, saying you're on the way down and you've got this, and the team here will be ready to meet you at the door and get your patient cared for as best we can. So it's a similar sort of procedure that would occur in an emergency setting at North Shore Hospital or any of the local hospitals.